Hello, thank you for joining me. My name is Anil Tailor. I'm a consultant gynecologist. I practice in the UK. Today I want to talk about how abnormal smears are generally treated. It should be a fairly quick overview, short video. So let's get on with it. I have covered many aspects of this talk in other videos. So there is a video on what an abnormal smear means, what the difference between cervical precancer and cancer, what does a colposcopy test involve, how is a loop biopsy or what is a loop biopsy of the cervix. All this has been covered in other videos. Please go and search them out. So essentially, to decide how abnormal smears are treated, first of all, we need to understand how abnormal smears are graded. So this has been covered in more detail in another video, but very briefly, smears in the UK are reported, the abnormal cells on the smear can be reported as of course, normal or borderline or mild or moderate abnormality or severe abnormality. So the low-grade abnormality is the borderline and the mild, and the high-grade abnormality is the moderate and the severe abnormality. All this is precancer abnormality, and it can take many years for precancer to eventually become cancer. So that's very briefly how abnormal smears are graded. So what is colposcopy? Colposcopy is merely an examination to look at the cervix under magnification. So we insert a speculum into the vagina, expose the cervix, and then look at the cervix under magnification. And this is what a cervix will generally look like to us under magnification. And then we will wash some of the mucus away using a mild vinegar solution, and by doing that, the acetic acid or the vinegar solution will also show up the abnormal cells as a white patch, and that essentially is colposcopy. So why do we need to do the colposcopy in the first place? Why don't we just believe smears and what they're telling us? Well, smears are not 100% accurate. So smears are approximately 90% accurate. And so what that means is that if, say, somebody has been referred with a low-grade abnormality, then it's 90% correct. So meaning there is a 10% chance that actually they are hiding a high-grade abnormality. And the purpose of doing the colposcopy is to find that group of women where that might be the case. Because generally speaking, we want to identify those with the high grade because they do warrant some treatment. The ones with the low grade abnormality, they can simply be monitored. So I suppose it can also work conversely in that if you're referred with a high grade abnormality, there is a 10% chance that actually you have a low-grade abnormality, and that the person who read the smear has just overcalled it. Now, if that is the case, then an argument could be put forward that, especially if you're young, that we shouldn't be interfering with your cervix. So if you don't need treatment, then we shouldn't be carrying that out, because perhaps that could have consequences, say, perhaps in future pregnancies. So that's the purpose of doing colposcopy, to find out whether the smear is correct and then tailor the treatment accordingly. So one of the ways of verifying the impression, the visual impression from the colposcopy is to take a small punch biopsy, which essentially takes literally a fraction of a second, usually does not hurt, and quite often you wouldn't even notice that a biopsy has just been taken. It is that quick. So that biopsy is then obviously looked at under the microscope, and that result will come back some weeks down the line, and that will tell us whether the smear is correct or incorrect. So if there is a high-grade abnormality, then that generally is treated in most cases. So meaning if there is a moderate or a severe abnormality, then you would be brought back to the clinic to have what we call a loop biopsy of the cervix. And that has been covered in another video, but essentially what a loop biopsy is, where we obviously identify the white area, and then on the cervix we would put some local anesthetic in 4 points, at 12 o'clock, 6 o'clock, 3 o'clock, 9 o'clock, put some local anesthetic, and once that local anesthetic is in, we will use a very thin wire, and using a special current through that wire, we'll be able to scoop away that white area, that would then be looked at under the microscope, and the pathologist would be able to verify that it has been removed or not removed. So once we've scooped away that area, generally there will be a little bit of bleeding, and we would apply some diathermy to that area. Again, it does not hurt because the local anesthetic is still working, and the diathermy would cauterize any of the bleeding. So the whole procedure would literally take about 5 minutes under local anesthetic. It is very well tolerated. Very, very, very rarely we would consider doing it in the general anesthetic, but that is not commonly required. So that essentially is a general overview of how abnormal smears are treated. So meaning the low-grade abnormalities are simply monitored. The high-grade abnormalities, we often just do a loop biopsy. There are other ways of treating it, but the commonest way of treating it in this country is by carrying out a loop biopsy. And that is all I want to say in this video. There are many other videos on a similar topic. Please go and search them out. And if you find these videos helpful, then please consider subscribing or clicking the like button. Thank you. Until next time, please stay safe.